Assessing the neurological and musculoskeletal systems. Initial steps. 1. Identify the patient. Rationale. Proper patient identification is critical to ensure that the care provided is intended for the correct individual. Misidentification can lead to errors in treatment, medication administration, and other aspects of care. 2. Explain the purpose of the procedure and answer any questions. Rationale. Effective communication is essential in nursing practice. Explaining the purpose of a procedure to the patient promotes trust, reduces anxiety, and allows the patient to be an active participant in their care. 3. Perform hand hygiene. Rationale. Hand hygiene is a fundamental infection control measure that helps prevent the transmission of pathogens between healthcare providers and patients. It is essential for patient safety. Nursing practice. Prior to any patient contact or procedure, nurses must perform proper hand hygiene by washing their hands with soap and water or using hand sanitizer. This practice helps reduce the risk of healthcare-associated infections. Hand hygiene is an essential practice in nursing that must be diligently observed in every procedure. This vital aspect of patient care serves as a cornerstone for infection prevention and control, and its importance cannot be overstated. In conclusion, hand hygiene is a non-negotiable component of nursing practice. It safeguards patients, promotes professionalism, reduces healthcare costs, and contributes to the overall health and well-being of both patients and healthcare providers. As nursing professionals, it is our responsibility to uphold the highest standards of care, and hand hygiene is a cornerstone of that commitment. 4. Help the patient undress if needed and provide a patient gown. Rationale. Providing a patient gown and assisting with undressing when necessary ensures patient modesty, comfort, and dignity during assessments and procedures. It also allows for proper examination of the body. Nursing practice. The nurse should offer the patient a gown and assist with undressing, ensuring that the patient feels comfortable and supported. Maintaining the patient's privacy and dignity is a fundamental aspect of nursing care. 5. Begin with a survey of the patient's overall hygiene and physical appearance. Rationale. Assessing the patient's overall hygiene and physical appearance provides important baseline information about the patient's health status. It helps identify any immediate concerns and informs subsequent assessments and interventions. Nursing practice. As part of the initial assessment, the nurse should observe the patient's skin, hair, nails, and general appearance for any signs of hygiene deficits, skin conditions, or abnormalities. Assessing neurovascular system. 1. Assess the patient's mental status. 1a. Evaluate the patient's orientation to person, place, and time. Rationale. Assessing orientation provides a baseline understanding of the patient's cognitive function. Changes in orientation may indicate delirium, dementia, or other cognitive impairments. Nursing practice. Ask the patient questions such as their name, current location, and the date to assess their orientation. 1b. Evaluate level of consciousness. Rationale. Evaluating consciousness helps detect signs of altered mental status, such as confusion or lethargy, which could result from various causes, including medication reactions or neurological issues. Nursing practice. Observe the patient's level of alertness and responsiveness. Assess whether the patient is awake, alert, drowsy, or unresponsive. 1c. Assess memory, immediate recall, and past memory. Rationale. Memory assessment helps detect cognitive deficits and memory impairments, which can be indicative of conditions like Alzheimer's disease or head injuries. Nursing practice. Ask the patient about recent events or past experiences to assess their immediate and past memory. 1d. Assess abstract reasoning by asking the patient to explain a proverb. Rationale. Testing abstract reasoning provides insight into the patient's higher cognitive functions. Impairments may indicate problems with problem solving and judgment. Nursing practice. Present the patient with a proverb or analogy and ask them to explain its meaning. 1e. Evaluate the patient's ability to understand spoken and written words. Rationale. Assessing language comprehension ensures that the patient can follow instructions, understand treatment plans, and communicate effectively. Nursing practice: give the patient simple commands or written instructions and assess their ability to comprehend and respond appropriately. 2. Testing for cranial nerve functions. 2a. Testing olfactory nerve smell. Rationale: evaluating the sense of smell helps identify neurological issues related to cranial nerve, olfactory, and can also detect potential safety hazards if the patient cannot smell dangerous substances. Nursing practice: present different odors to the patient and assess their ability to identify them. 2b. Test for visual acuity and pupillary constriction. Rationale: visual acuity and pupillary responses provide information about the integrity of cranial nerves to optic and oculomotor. Abnormalities may indicate visual deficits or neurological issues. Nursing practice: use an eye chart to test visual acuity and assess pupillary reactions to light. Visual acuity testing: utilize an eye chart, for example, Snellen chart positioned at the standardized distance of 20 feet or as appropriate for the patient's age and condition. Ask the patient to cover one eye and read the smallest line of letters they can see. Pupillary reaction assessment: to assess pupillary constriction, ensure the room is dimly lit. Shine a pen light or a focused light source into each eye separately. Observe the pupillary response, looking for the following: direct reaction: the pupil of the illuminated eye should constrict briskly. Consensual reaction: simultaneously, the pupil of the non-illuminated eye should also constrict. 2c. Move the patient's eyes through the cardinal position of gaze. Rationale: evaluating eye movement helps assess cranial nerves 3, 4, and VI oculomotor, trochlear, and abducens. Abnormal eye movements can indicate neurological or muscular disorders. Nursing practice: ask the patient to follow your finger as you move it in different directions to assess eye movements. In summary, moving the patient's eyes through the cardinal positions of gaze is an integral component of neurological assessment in nursing. This assessment helps to evaluate the integrity of cranial nerves III, 4, and VI, which are essential for controlling eye movement. 2d. Ask the patient to smile, frown, wrinkle forehead, and puff out cheeks. Rationale: evaluating facial expressions and the patient's ability to perform these facial movements. Tests cranial nerve 7 facial. It helps identify any facial weakness, asymmetry, or issues related to this nerve, which is crucial for various functions, including speech, eating, and emotional expression. Nursing practice: request the patient to perform a range of facial movements, including smiling, frowning, wrinkling the forehead, and puffing out the cheeks. Observe for any abnormalities, such as weakness or asymmetry in these facial expressions. This evaluation is crucial for assessing cranial nerve 7, the facial nerve, which controls various facial muscles involved in expressions, speech, and eating. Detecting abnormalities, weakness, or asymmetry in these facial movements can provide early indications of nerve dysfunction. 2e. Test hearing. Rationale: evaluating hearing helps identify hearing impairments or issues related to cranial nerve 8 vestibulocollar. It ensures that the patient can effectively communicate and respond to auditory stimuli. Nursing practice: conduct hearing assessments such as the whisper test or tuning fork tests to evaluate the patient's auditory function. 2f. Test the gag reflex by touching the posterior pharynx with the tongue depressor. Rationale: testing the gag reflex assesses cranial nerve 9 glossopharyngeal and X vagus and is important for evaluating the patient's ability to protect their airway and swallow safely. Explaining potential discomfort prepares the patient for this assessment. Nursing practice: gently touch the posterior pharynx with the tongue depressor while instructing the patient to be prepared for potential discomfort. This ensures the integrity of the gag reflex. 2 grams. Place your hands on the patient's shoulders while he or she shrugs against the resistance. Then place your hand on the patient's left cheek, then the right cheek, and have the patient push against it. Rationale: testing strength by assessing muscle strength of the shoulders and cheeks helps evaluate cranial nerve sheath accessory and its contribution to motor function. It helps identify weakness or asymmetry. Nursing practice: apply resistance to the patient's movements, observing for any signs of muscle weakness or difficulty in maintaining muscle strength. 2 hours. Inspect the ability of the patient to move his neck. Ask the patient to touch his or her chin to chest and to each shoulder, each ear to the corresponding shoulder, and then tip the head back as far as possible. Rationale: assessing neck movement tests cranial nerves, sheath accessory, and 12 hypoglossi. 3. Ask the patient to close his or her eyes. Place a familiar object, such as a key, in the patient's hand, and ask him or her to identify the objects. Repeat on the other hand with a different number. Rationale: sensory assessments, such as identifying objects by touch, help evaluate sensory perception and discrimination. It is essential for detecting sensory deficits. Nursing practice: assess the patient's ability to recognize and distinguish objects by touch, promoting a comprehensive sensory evaluation. 4. Ask the patient to close his or her eyes. Using your finger or applicator, trace a 1-digit number on the patient's palm and ask him or her to identify the number. Repeat on the other hand with a difference. Rationale: sensory assessments involving number recognition test the patient's ability to perceive and identify tactile stimuli, aiding in the detection of sensory deficits. Nursing practice: trace numbers on the patient's palm and assess their ability to identify and differentiate the numbers by touch, contributing to a thorough sensory assessment. 5. Assess the patient deep tendon reflex. 5a. Place your fingers above the patient's wrist and tap with a reflex hammer, repeating the other arm. Rationale: assessing deep tendon reflexes, such as the brachioradialis reflex, helps evaluate the integrity of the peripheral nervous system. Changes in reflexes may indicate underlying neurological conditions or injuries. Nursing practice: use a reflex hammer to elicit and compare the brachioradialis reflex in both arms, observing for symmetry and appropriate reflex responses. 5b. Place your fingers over the antecubital area and tap with a reflex hammer repeatedly on the other side. Rationale: evaluating the biceps reflex assesses the function of the C5 and C6 nerve roots and helps identify potential neurological issues. Nursing practice: use a reflex hammer to elicit and compare the biceps reflex in both arms, checking for symmetry and appropriate reflex responses. 5c. Place your finger over the triceps tendon area and tap with a reflex hammer. Repeat on the other side. Rationale: testing the triceps reflex evaluates the function of the C7 nerve root and can detect abnormalities in this reflex arc. Nursing practice: use a reflex hammer to elicit and compare the triceps reflex in both arms, looking for symmetry and appropriate reflex responses. 5d. Tap just below the patella with a reflex hammer. Repeat on the other side. Rationale: assessing the patellar reflex knee-jerk reflex helps evaluate the function of the L2, L3, and L4 nerve roots and detects potential issues in this reflex pathway. Nursing practice: use a reflex hammer to elicit and compare the patellar reflex in both knees, ensuring symmetry and appropriate reflex responses. 5e. Tap over the Achilles tendon area with a reflex hammer. Repeat on the other side. Rationale: testing the Achilles reflex assesses the function of the S1 and S2 nerve roots and helps identify abnormalities in this reflex arc. Nursing practice: use a reflex hammer to elicit and compare the Achilles reflex in both ankles, observing for symmetry and appropriate reflex responses. 6. Stroke the sole of the patient's foot with the end of a reflex hammer handle or other hard object such as a key. Repeat on the other side. Rationale: assessing the plantar reflex. Babinski reflex helps evaluate upper motor neuron function. 7. Ask the patient to dorsiflex and then plantar flex both feet against the opposing resistance. Rationale: testing the strength of dorsiflexion and plantar flexion of the feet assesses motor function, muscle strength, and the function of the lower extremities. Nursing practice: Apply resistance while instructing the patient to dorsiflex and plantar flex their feet, assessing for muscle strength and any limitations or weaknesses. 8. As needed, assist the patient to a standing position. Observe the patient as he or she walks with a regular gait, on the toes, on the heels, and then heel to toe. Rationale: assessing the patient's ability to stand and walk with a regular gait, on their toes, and heel to toe helps evaluate motor function, balance, and coordination. It detects abnormalities or gait disturbances. 9. Perform the Romberg's test. Ask the patient to stand straight with feet together, both eyes closed with arms at side. Wait for 20 seconds and observe for patient swaying and ability to maintain balance. Nurse must be alert to prevent fall or injury related to losing balance during this assessment. Rationale: the Romberg test assesses the patient's ability to maintain balance and proprioception awareness of body position when visual input is removed. It helps detect sensory and balance deficits. Nursing practice: instruct the patient to stand with feet together, close their eyes, and observe their ability to maintain balance for a specified time. Ensure that the nurse is alert to prevent falls or injuries during the assessment. Assessment of the musculoskeletal system. 1. Ask the patient to extend arms forward and then rapidly turn palms up and down. Rationale: this assessment evaluates the range of motion and coordination of the patient's shoulder joints, as well as their ability to supinate and pronate the forearms. Nursing practice: observe the patient's ability to extend their arms and rapidly turn their palms up and down, checking for smooth and coordinated movements. 2. Ask the patient to flex the upper arm and to resist the examiner's opposing force. Rationale: assessing muscle strength in the upper arm's biceps helps evaluate the function of the brachial nerve and detects any muscle weakness or abnormalities. 3. Inspect and palpate the hands, fingers, wrists, and elbow joints. Rationale: visual and tactile inspection of the hands, fingers, wrists, and elbow joints helps identify deformities, swelling, tenderness, or abnormalities that may be indicative of musculoskeletal conditions or injuries. 4. Have the patient squeeze 2 of your fingers. Rationale: evaluating grip strength by having the patient squeeze the nurse's fingers helps assess muscle strength in the hand and fingers. A decrease in grip strength may indicate muscle weakness or neurological issues. 5. Have the patient perform the straight leg test with one leg at a time. Rationale: the straight leg test assesses the patient's ability to perform hip flexion and detects any limitations or pain in the lower back and hip areas. Nursing practice: ask the patient to lift one leg at a time while keeping it straight, observing for any discomfort or limited range of motion. 6. Ask the patient to move one leg laterally with the knee straight to test abduction and medially to test adduction of the hips. Rationale: testing hip abduction and adduction assesses the patient's hip joint function and detects any limitations in movement or pain associated with these acti. 7. Ask the patient to raise the thigh against the resistance of your hands. Next, have the patient push outward against the resistance of your hands. Then have the patient pull backward against the resistance of your hand. Repeat on the opposite side. Rationale: these assessments evaluate the strength of the patient's hip and thigh muscles, quadriceps, and hamstrings and detect any muscle weakness or imbalances. After procedure steps. 1. Assist the patient to a comfortable position. Rationale: after a comprehensive assessment, it's essential to prioritize the patient's comfort and well-being. Helping the patient assume a comfortable position ensures their physical comfort and emotional ease. Nursing practice: gently assist the patient in adjusting their position, whether it's reclining, sitting, or lying down, based on their preference and physical condition. 2. Perform hand hygiene. Rationale: hand hygiene is a critical infection control measure that should be practiced before and after any patient interaction or procedure. It reduces the risk of cross-contamination and helps maintain a sterile environment. Nursing practice: after completing the assessment, wash your hands thoroughly with soap and water or use hand sanitizer to ensure that your hands are clean and free from potential pathogens. Performing hand hygiene is an essential and fundamental practice in healthcare settings that involves thoroughly cleaning one's hands to reduce the transmission of infections and maintain a safe and sterile environment. This practice is crucial for healthcare professionals, including nurses, as it directly contributes to patient safety and the prevention of healthcare-associated infections. In conclusion, hand hygiene is a fundamental aspect of nursing practice that plays a pivotal role in preventing the spread of infections and ensuring patient safety. 3. Document the findings of the assessment. Rationale. Accurate and timely documentation of assessment findings is a fundamental component of nursing practice. It serves as a legal record of the patient's condition in communication among healthcare providers. Thank you, students, for your attentive participation during the Neurovascular and Musculoskeletal assessment. Best of luck in your studies.